So are you like a 6-month touch-up person?
Uh,
Or maybe a 12-month person?
or, one of those wait 3 years people.
Right, exactly. Just think about it for a second.
Yeah.
Because when you get a haircut, you know exactly when you're going to need the next one.
Yeah, or like when you change the oil in your car.
Whereas you literally get a little sticker on the windshield telling you the exact mileage. But the moment you step into the world of dermal fillers, that predictable calendar just gets thrown completely out the window.
It really does. And honestly, it leaves a lot of patients incredibly confused. I mean, they look at a date on a calendar, they hit that 6-month mark, and they just assume their tank is empty.
Because that's what the brochure says.
Right, exactly. But the human face isn't a car, and you aren't maintaining a static machine. You're interacting with this living, highly reactive biological ecosystem.
Well, welcome to this customized deep dive. Today, we are focusing entirely on you. If you're someone considering aesthetic treatments, or honestly, if you're just insanely curious about the biology of anti-aging,
Which is fascinating, by the way.
it is. We're giving you the ultimate shortcut to being like the most well-informed person in the room. Our focus today is how clinicians actually figure out your hyaluronic acid filler maintenance timing.
Right, specifically based on your individual metabolic turnover.
Exactly. And spoiler alert for anyone listening, your timeline has almost nothing to do with what the product's marketing brochure says.
Yeah, zero. It has everything to do with your unique chemistry.
So to get to the absolute bottom of this, we've pulled a massive stack of sources for you. We're looking at clinical aesthetic guidelines, the latest scientific journals on the physics of how these gels behave under the skin, and real-world clinical protocols.
Yeah, the data out there right now is just incredible.
It really is. Our mission today is to unpack exactly why these timelines aren't one-size-fits-all. We want to show how your body actively dictates your personalized schedule.
Because it's this phenomenal intersection of, chemistry, physics, and human biology. Before a clinician can even think about adjusting your maintenance schedule, they have to understand what your body is actively doing to the product, like from the absolute second it gets injected.
Okay, let's unpack this because the foundational chemistry part totally blew my mind. So native hyaluronic acid, the stuff your body makes naturally in your skin, eyes, and joints.
Yeah, the endogenous stuff.
Right. It basically has a half-life of less than 1 to 2 days.
Which is so fast when you really think about it.
Crazy fast. We're constantly churning it out. And it's just constantly being chewed up and recycled by these natural enzymes in our bodies called hyaluronidases.
And what's fascinating here is that those enzymes act like microscopic scissors. I mean, their entire job is to patrol your tissue and chop up native hyaluronic acid so your body can flush it out and replace it.
Which totally makes sense from a biological standpoint. But the filler they inject in a clinic lasts anywhere from 6 to 18 months, sometimes even longer.
Oh, definitely longer in some cases.
So obviously, they aren't just injecting the native stuff. Now, the original analogy I read in the sources was that native HA is like a flimsy piece of paper, and filler is like taking that same paper and heavily laminating it.
Yeah, I've heard that one.
But that doesn't really explain what's happening on a molecular level, does it?
No, not really. I mean, the lamination analogy falls a bit short because it implies there's this protective coating around it.
Right, like a plastic sleeve or something.
Exactly. A better way to visualize it is to think of native hyaluronic acid as a pile of loose individual threads. If you hand those loose threads to those microscopic scissor enzymes, they can just chop them to pieces in minutes.
Just easy work.
Oh, incredibly easy. But to make the product last for months, manufacturers use a technology called cross-linking.
Ah, okay.
They introduce a chemical binding agent, usually one called BDDE, and this agent essentially ties all those loose threads together into this dense, tightly knotted fishing net.
So they transform a free-flowing liquid into a stabilized three-dimensional physical structure.
Precisely. So when your body's enzymes come along to clear it out, they can't just snip a single thread anymore. They have to slowly and painstakingly chew through this incredibly dense web of chemical knots.
So they basically build a microscopic fortress out of sugar molecules.
That's a great way to put it.
But, no fortress is invincible. And diving into these sources, this is where your individual metabolism just crashes the party.
Oh, absolutely. Metabolism is the ultimate wild card here.
Because the research highlights that younger patients, or people with highly active lifestyles like marathon runners, competitive athletes, heavy gym goers, they process and break down this cross-linked filler way faster than the average person.
Significantly faster.
Wait, I have to stop here and ask a practical question. Because if I'm someone paying thousands of dollars for filler and I have a highly active lifestyle, am I literally sweating out my investment on the treadmill?
Well, no, you aren't sweating it out through your pores, but you are actively accelerating its destruction from the inside.
Oh, wow, really?
Yeah. When you engage in heavy, regular cardio, a few systemic things happen. First, you dramatically increase your blood flow.
Makes sense. Your heart is pumping faster.
Right. And more blood flow means a higher volume of those natural scissor enzymes are constantly washing over the filler site.
Yeah.
You're essentially turning up the hose.
Okay, so it's a volume game. More blood means more enzymes.
That's part of it, for sure. But the second and honestly more destructive factor is that intense exercise generates reactive oxygen species.
Oh, wait, you mean free radicals?
Those exact things, the
Yeah.
things we take antioxidants to fight.
Right.
When you push your body hard, oxidative stress occurs. And these free radicals, they don't need to wait around for an enzyme to do the work.
They just attack it directly.
Exactly. They are highly volatile molecules that can directly attack and break apart those chemical knots in the fishing net we talked about.
That is wild.
And if you add in the increased core body heat from intense workouts or, sitting in a sauna 5 days a week, you're creating a hyper-accelerated chemical breakdown environment.
So a clinician really has to do a lifestyle audit before they ever even touch a syringe.
They absolutely should.
Like if I walk in as a CrossFit athlete who essentially lives in the sauna and the clinician promises me my cheeks will look perfect for a standard 12 months, they're just completely ignoring the reality of my engine.
They are setting you up for failure. Your overall bodily engine dictates the systemic speed limit for how fast you metabolize this product.
Okay, but reading through the clinical guidelines, your systemic metabolism is just layer 1.
Just the tip of the iceberg, yeah.
Because the clinician also has to map out the microenvironment of your face. Because apparently, different areas of your face chew through filler at wildly different speeds.
Right. Regional metabolism is a massive factor. We have to consider the mechanics of the facial geography.
Because the face isn't a flat canvas.
Exactly. It's a highly active mechanical landscape.
The analogy that made this click for me in the sources was comparing lip filler to the tire tread on a race car, and then comparing cheek filler to the spare tire sitting safely in the trunk.
I love that visualization because it perfectly captures the mechanical reality. Like, let's look at the lips and the area around the mouth, right? Those marionette lines that drop down from the corners of the lip.
Yeah, the ones everyone hates.
Right. This is a high vascularity, high movement zone. The circular muscles around your mouth are constantly firing. You're talking, eating, smiling, expressing all day long.
It's just endless friction.
Endless friction. That constant muscle activity creates continuous mechanical stress. You are physically shearing and grinding the filler network against itself.
Ouch. And all that blood flow brings in more enzymes too, right?
Exactly. The dense network of blood vessels in the lips brings in a constant, heavy supply of degrading enzymes. That combination of mechanical grinding and chemical breakdown is why lip filler generally degrades within 6 to 9 months.
Even in a person with a totally average baseline metabolism.
Yeah, even then, it's just a harsh environment for the product.
Okay, and then we have the spare tire in the trunk.
Right. The spare tires. These are areas like the cheeks, the temples, or the jawline. In these zones, the product is usually placed much deeper, often resting right on top of the bone.
So it's providing structural support there.
Exactly. But more importantly, there is minimal mechanical movement. Your jawbone isn't folding and stretching the skin the way your lips do.
So it just kind of sits there, mostly undisturbed.
It basically sits quietly in the dark. The exact same syringe of product that breaks down in the lips in 6 months can easily persist along the jawline for 12 to 24 months, simply because it isn't being subjected to that constant mechanical shear.
Wow. So if the jawline holds on to filler for 2 years, but the lips chew through it in 6 months, a clinician relying on a basic calendar is going to make a massive mistake.
A huge mistake.
Like if you go in for a 6-month lip touch-up and they decide to just top off your jawline because, well, it's time, they are adding product to an area that absolutely doesn't need it.
Which happens all the time, unfortunately.
But this brings up the wild card zone of the face, the tear troughs, right under the eyes. The sources say this area is totally unpredictable. It can last 6 months or it can sit there for up to 3 years. Why is the under eye so weird?
Well, it comes down to a very strange anatomical environment. First, the skin in the periorbital region is incredibly thin.
Right.
There's very little muscle compression compared to the mouth, so you lack that mechanical grinding we just talked about.
Okay, so no race car tread wear.
Right. Furthermore, the lymphatic drainage in this area can be quite sluggish. Because it's such a delicate, low-flow environment, the body's natural clearing mechanisms operate at an absolute crawl.
Okay, so imagine you're the patient sitting in the chair, right?
Right.
You know your lips feel a bit deflated, so you just naturally assume your whole face needs a top-up.
Right, that's the natural instinct.
If they can't use a calendar, and every zone of your face is operating on its own unique metabolic timer, what metric is the clinician actually using to decide your tank is empty?
That is the million-dollar question.
So the sources introduce a concept called the 75% rule.
Ah.
The general guideline is that clinicians recommend scheduling a maintenance appointment when about 75% to 80% of the initial filler effect still remains.
That's the standard teaching, yeah.
And the stated logic is that it prevents the filler from dropping off completely, it requires like product per visit, and it keeps your look perfectly consistent day to day.
Sounds great on paper, doesn't it?
Here's where it gets really interesting, because I have to push back on this. This just sounds like a recipe for disaster.
Go on.
If my car's gas tank is 75% full, and I go to the gas station and try to pump a full gallon in, it's going to spill all over the pavement. Doesn't topping up a tank that is mostly full directly contradict the less is more rule of aesthetics? Aren't we just causing a massive pileup of filler over time?
This raises an important question, and honestly, you are hitting on the most dangerous trap in aesthetic medicine.
Really, so the logic holds up.
Your logic is perfectly sound. Adding to a 75% full tank repeatedly absolutely will cause a pileup, but the 75% rule only works if the clinician accurately assesses that you are actually at 75%.
Which I'm guessing is harder than it sounds.
Much harder, because the primary obstacle to making that assessment is a really powerful neurological phenomenon called visual adaptation.
Meaning, we just get used to our own faces in the mirror.
It's deeper than just getting used to it, actually. The human brain is evolutionarily wired to filter out static stimuli. I mean, your brain's primary job is threat detection, which means it pays intense attention to changes in your environment or your appearance.
Okay, so when you first get filler, your brain sees that sudden increase in volume as a major change.
Exactly. It focuses on it completely.
You walk past a mirror and you literally can't stop looking at your new lips or your new jawline.
Right. But within a few weeks, those new lips become static. They are no longer a new change, they are the baseline. Because they aren't a threat or a novel stimulus anymore, your brain simply stops registering the extra volume. It filters it out to free up cognitive bandwidth for new changes.
Once that neurological adaptation happens, patients inevitably experience the feeling of, oh no, it's gone, it faded, it's not enough.
Yes, the filler is still physically sitting there, completely intact, but your brain has essentially photoshopped it out of your self-perception.
That is terrifying.
It is. So what happens? The patient goes back to the clinic at 6 months. They are utterly convinced their fast metabolism burned through the filler, and they demand more.
And because they're a paying client in a very lucrative industry, and let's be honest, it's much easier to just say yes than to give a lecture on evolutionary biology, the injector complies.
And that is the exact mechanism behind facial overfilled syndrome, or FOS.
FOS.
Right. It's a behavioral loop compounding a biological reality. The filler hasn't metabolized the patient's perception of it has.
So if the injector just blindly follows the calendar or the patient's request without rigorously tracking the cumulative volume under the skin, the hyaluronic acid just builds up layer by layer.
Exactly. And the clinical guidelines we're looking at clearly state that full face volumes exceeding 4 to 6 milliliters per year are a major red flag for this kind of dangerous accumulation.
So if the patient genuinely believes they need more, and they are literally begging for it, how does a clinician gently tell them no? Like, how do they break that loop?
Well, a master clinician manages that biological loop through rigorous objective assessment. They don't just look at you across the room.
What do?
They rely heavily on palpation, literally pressing on and feeling the tissue to assess the density and structure of the residual filler.
That makes sense.
They also perform facial proportion analysis, comparing your current bone structure and soft tissue to historical photos from before you ever even touched a needle, not just relying on the patient's memory.
Which is crucial, because as we establish, the patient's memory is totally compromised by visual adaptation.
Exactly. They also rely on outside feedback, which is a fascinating clinical tool.
What do you mean by outside feedback?
Like, if you come into a clinic and mention that friends or family members who haven't seen you in 6 months say you look a little stiff or different, that is a massive clinical clue.
Because the occasional observers see the objective reality.
Right. The daily observers, including your spouse and yourself, adapt to the micro changes. If people who haven't seen you recently think you look stiff, your metabolic turnover has not caught up with your injection frequency.
Which means your tank isn't at 75%, it's overflowing.
Exactly.
And because of the exact risk of that invisible pileup, humans adapting and clinicians guessing, the aesthetic field is actually undergoing a massive technological shift right now.
Oh, it's revolutionary.
Yeah, they're moving past just feeling the skin or looking at old photos.
Hmm.
Modern clinicians are now using high-resolution ultrasound and MRI scans to look directly under the skin and map the actual filler persistence.
And the data coming out of these scans is mind-blowing. It is forcing a complete rewrite of the medical rulebook. We are seeing things we never thought were possible.
So what does this all mean? According to a 2024 meta-analysis looking specifically at these scans, 50% to 86% of hyaluronic acid volume can persist at 24 months.
Over 2 years.
Over 2 years. And the vast majority of it is still there. The scans also show it sometimes migrating between different facial compartments over that time.
Which changes everything.
Right. So if I have a product still glowing on an MRI scan 3 years after I got injected, are we fundamentally misunderstanding the word temporary? Is marketing just totally disconnected from the biology?
Well, if we connect this to the bigger picture, it's not necessarily a lie, but it stems from a fundamental misunderstanding of what happens in the tissue after injection.
How so?
When patients hear temporary, they imagine the filler is like an ice cube. They think it's an inert puddle of liquid sitting in a sterile pocket under their skin, and over 12 months, it just slowly and cleanly melts away to nothing.
I mean, that is 100% how it's visualized by the general public.
But that's not biology. Filler integrates. When it's injected, it enters a highly dynamic living environment. First, because hyaluronic acid is hydrophilic, it binds to water. It alters the local hydration behavior of your face.
Okay, so it pulls water in.
Yes. Second, the physical presence of this gel induces something called fibroplasia.
Okay, what does that mean for the listener?
Fibroplasia is the body's natural response to a foreign substance. It starts laying down a delicate scaffold of new collagen right around the filler implant. It's essentially weaving the gel into your own facial fabric.
Oh, wow.
And third, it is subjected to the mechanical forces of your facial muscles, which can slowly spread or push it along anatomical planes beneath the skin.
So this is why we see it persisting on MRIs for years.
Exactly. By year 2, it is no longer just a blob of filler. It is an integrated filler tissue complex.
Okay, wait. If it's literally woven into my own newly formed collagen, that completely changes how you have to treat an overfilled patient.
Oh, dramatically.
Like, if my jawline is overfilled, I can't just wave a magic wand and erase the filler because my own tissue is wrapped around it. If dropping a massive dose of that dissolving enzyme causes chaos, how does a clinician actually fix a pileup?
It's a great question.
Are they just forced to tell the patient to wait 3 years for it to degrade naturally?
Well, historically, the narrative was dissolve and replace. If there was too much product, the injector would flood the area with a massive dose of synthetic hyaluronidase enzyme, try to wipe the slate clean, and just start over.
Yikes.
Right. But as you just deduced, because the filler is deeply integrated with your own tissue and newly formed collagen, dropping a bomb of dissolving enzyme doesn't just cleanly melt the filler.
It damages the natural tissue.
It can severely disrupt the entire tissue architecture that has grown around it. That leads to a sudden collapse of facial contours, loose skin, and, frankly, severe psychological distress for the patient.
Okay, so they can't just clear-cut the forest. What do?
Clinicians are radically shifting their mindset from dissolving filler to carefully modifying it.
Modifying it.
Right. If a patient is overfilled, they now use a staged ultrasound-guided approach. Instead of one massive dose of enzyme, they use a multi-dose protocol.
Which looks like what?
This involves using ultrasound to locate the exact pockets of heavy filler accumulation and then doing repeated, highly targeted micro-injections of the dissolving enzyme every 20 to 30 minutes during a single session.
Ah, so spacing it out to watch what happens in real time.
Exactly. It maximizes the chemical action of the enzyme while allowing the clinician to observe the real-time tissue response. They do a little bit, watch the tissue settle, check the ultrasound, and do a little more.
It is a highly controlled volume reduction.
Yes. To use your analogy, they are carefully pruning the overgrown branches rather than clear-cutting the entire forest.
That is fascinating. It's like precision medicine applied to aesthetics. They're actively mapping the cumulative volume in your specific face, kind of like a submarine using sonar to map the ocean floor.
That's a perfect comparison. It is treating the patient's unique biological reality rather than relying on a generic marketing timeline or just a blind guess.
And this ultrasound-guided, assessment-based maintenance is rapidly replacing the old model of just blindly booking a top-up every 6 months.
Thank goodness, yes. It's so much safer.
So if you're listening to this and wondering when to book your next appointment, we really want to bring this all together for you.
Eh.
Maintaining germal filler is absolutely not a set-it-and-forget-it calendar alert.
Not at all.
It is a highly individualized, incredibly complex biological math equation. It combines the dense chemical cross-linking of the specific product in the syringe, the mechanical movement and vascularity of the specific facial zone being treated, and your own unique systemic metabolic rate.
It really demands a clinician who understands that they aren't just topping off a gas tank. They are managing a living, reactive biological system over the course of years, and they need to track that integration accurately.
Exactly. And as we wrap up this deep dive, I want to leave you with one final provocative thought to ponder based on the source material. We've established that your individual metabolism dictates how long filler lasts. But we also know that our metabolisms aren't fixed forever.
Far from it. I mean, they change with age, with stress, with hormonal shifts, and importantly, with medical interventions.
Exactly. And right now, we are seeing a massive cultural wave of rapid weight loss driven by GLP-1 medications like Ozempic or Wegovy.
Right, which drastically alter body composition.
Yeah. We know they accelerate facial volume loss simply because the fat pads in the face shrink rapidly. But they also fundamentally shift your systemic metabolic rate.
They change the whole engine.
Right. So let's run a thought experiment based on the science we covered today. Imagine you got filler injected deep into your cheeks 3 years ago. You were at a completely different body weight, you had a different activity level, and your face had a completely different metabolic environment.
Right.
That cross-linked filler integrated into your tissue weaving with collagen and binding water based on that biological version of you.
It adapted to that specific ecosystem.
Exactly. If you undergo a massive metabolic shift today, dropping 50 pounds and changing your systemic chemistry, how does that temporary filler, which we now know from MRI scans can hide in deep tissue for years, react to the brand new biological ecosystem of your face?
It's a staggering question.
When your face loses its natural fat, does the integrated filler suddenly become visible? Does the new metabolic rate accelerate its breakdown, or does it leave it stranded as the tissue around it changes?
Because as our bodies rapidly change, how does the invisible architecture we built inside them years ago hold up to the new reality?
It is a fascinating and honestly slightly wild frontier for both patients and clinicians to navigate in the coming years.
It definitely is. There's so much more to learn.
Well, thank you so much for joining us on this journey into the hidden science of aesthetic maintenance. We hope this customized deep dive gave you the exact tools you need to ask the right questions, push back on generic timelines, and truly understand the biology behind the mirror. Keep questioning, keep learning, and we'll be right here ready to dive into the next stack of research with you.